I titled this one, What's Wrong with Lactation Care in America? And I'm sure that's gonna make you think that I'm gonna criticize all the amazing lactation consultants in America and what they do, but that's actually not what this is about. This is about how we as a medical system and culture in America care for lactating women and what's wrong with it, or how the state of it right now. So first thing I have on my list is providers don't refer enough to lactation. I'm a provider, I'm a PA. I don't work in pediatrics, but if I did, I'd be referring to lactation like every time. If she's breastfeeding or isn't and wants to be, boom, lactation. Like, please go see lactation. The general care provider in the role of pediatrician, or even in the role of primary care provider for mom, or the OB or midwife for mom, they are trying to focus on all of baby or all of mom. It's really hard to do that and get into the nitty-gritty, teeny details that you have to address with breastfeeding. And the pediatrician is only focused on the baby, whereas the primary care provider, OB or midwife, is only focused on the mom. Who is looking at them both together? Lactation. If there are weight gain issues, blood sugar issues, jaundice, this mom-baby pair should be seeing lactation. But over and over again, we see that it's not happening. They're not being referred. And I don't know if providers just assume, oh, mom would ask to see lactation if she wanted to. Mom may not know that lactation exists. Mom may not know that lactation is available. Mom may not know that lactation a lot of times, or should be, is covered by her insurance. Providers need to be the ones suggesting this, bringing it up, advocating for their patients. Breastfeeding is not only like a nice sentimental thing to do, it is so crucial to public health of the baby and the mother as individuals, as well as the public health as a whole. When we have these systems in place, it can really impact the health of the whole public over many years. So providers need to get on the bandwagon and refer to lactation. You are not a breastfeeding expert, and that's okay. You're an expert in many things. If lactation is not one of them because you don't have additional education, training, or certifications about lactation, just be humble and do the right thing and do no harm and refer to someone who knows what they're doing. Okay, second thing kind of piggybacks this. What's wrong with lactation care in America is that providers, again, I am one, so I'm one of you. I can speak to you like this, I hope. Providers are giving bad advice about breastfeeding. Outdated, not evidence-based advice. Like many subspecialties out there, the care in the lactation world, the standards, changes all the time because new research is finally coming out and being done. Our understanding of things is evolving and changing and growing. So if you're not active in those communities and actively staying up to date on practices and evidence, you're gonna fall out of date with things. Shameless plug for the Infant Risk Center in Texas. They are dedicated to researching the safety of medications in breastfeeding mothers and for the infants. Lean on them. You can call them anytime at their toll-free number. Parents can call, providers can call. They have a really awesome app. It is like $10, but to me, like, best $10 I've spent in a long time. There's a healthcare provider version. If you're a healthcare provider and you see lactating women in your practice, please download it. There's a parent version, so you can always check. Third thing, there's very minimal breastfeeding support immediately postpartum, at least from my little corner of America in the South. I live in North Carolina. A lot of our major hospitals do have lactation consultants in, the Raleigh-Durham area, but community hospitals often don't. And even if you are in one of the big hospitals, if you're able to see the lactation consultant, they are so understaffed and overwhelmed with patients that they, unfortunately, they're doing the very best they can. It's an incredibly challenging job. They can only spend 15-20 minutes with a mom and baby. And if you haven't tried to take care of a mom and baby in 20 minutes, I'll just tell you, it's basically impossible. There's very little that you can assess and give advice on in that period of time. You really need an hour, 90 minutes even. the time initial visits are 90 minutes when you see a lactation consultant outpatient, and that's for a reason. Here's what I'll say. That first window of those first few days and week or two is so critical to how the rest of the breastfeeding journey will go, that a lot of moms are just not getting any or not getting much breastfeeding support in that window of time. And by the time they do see a lactation consultant a few weeks after birth, it's really hard to put the pieces back together and salvage what you can to give them the breastfeeding experience that they want and deserve. So that's my third thing I think that we need to fix, is really early support being much better. Fourth thing, I have 5 by the way, so we're almost there. Fourth thing is insurance coverage problems. There's been this shift to where insurance companies, some of them, are not wanting to cover lactation care. In some states, they don't even recognize lactation consultants as healthcare people, providers, which is bananas to me, but okay. Some insurance companies are requiring that lactation consultants partner with a provider like myself, a nurse practitioner, a doctor, in order to bill for their services. Like, why are we creating more barriers? I think if insurance companies really understood the public health benefit and the individual health benefits of breastfeeding for mom and baby, they would realize that actually it would probably be cheaper, because, you know, unfortunately healthcare is a business, and unfortunately insurance companies focus a lot on money in, money out, because they're businesses. If they realize that it would maybe save them money to protect, promote, and support breastfeeding in the long run in terms of illnesses and preventable things, maybe they would cover it more. I don't know. It's kind of insane to me. And if they do cover lactation visits, a lot of times the reimbursement is really poor. So like, guys, if we're gonna do what's right for the individual and public health, and we're gonna support, protect, and promote breastfeeding, we've got to pay the people who are doing it, who are doing the work. And that is lactation consultants and other lactation professionals like me. I'm a certified lactation counselor. I am working towards my lactation consultant certification. It just takes literal years to do. It's very challenging to get. But anyways, there are lots of people in the lactation space that provide care for families. And we just want to provide that care in a way that is accessible to these families. A lot of these families cannot afford to see lactation unless their insurance pays for it. Because realistically, you need to see lactation like serially, like weekly, for a while, at least a month. Maybe not always that often, sometimes more. So if we're really gonna support families in the way that they deserve, we gotta do it in a way that they can access. And then my last thing is probably not just an American phenomenon, but it's this desire from mothers. I'm a mother too, so I'm calling you out too. We just wanna find everything on social media or on Google. I don't know if it's because we don't want to have to like contact another human being. I mean, I hate talking on the phone, so again, I'm one of you. Or we just want to like figure it out all on our own, but we just go to the internet for everything. We go to Google, we go to social media, we go to chat rooms, not really chat rooms anymore. We go to Facebook groups, we go to, you know, all these places that are not one-on-one medical care. We want, I don't know if it's the simplicity, it's that it's free. Maybe it's that we don't have time, energy, mental, emotional capability in the postpartum period to like add another thing on. But I just have to encourage you who are listening, if you are a mother or you're soon to be a mother, don't rely on the generalized information that you're going to get on the internet to give you what will work for you and your baby. Just like any area of medical care, lactation care is really so nuanced. And what works for one mother and baby does not work for another. So you can get lots of great advice and tips and strategies online. I mean, I provide that. It's like a big part of my platform is educating. And there is a place for general education about breastfeeding, prenatal prep, and in the thick of it type stuff. But there's a limit to what you can gain there. And I think we have kind of strayed as Americans into this distrust of the medical system land. And I see the reasons for that. I can empathize and understand people's experiences and have led them to this place where they maybe don't trust the medical system or the people working in it as they once did. But I just want to encourage you that a lot of us here are here because we love y'all and we are passionate about supporting you and your goals, and we don't want to take your autonomy. We don't want to tell you what to do. We want to be there for you in a way that supports who you are, what you want out of this experience and season of life, and ultimately promotes your health and your baby's health. So if you can just take that at face value and trust us, find someone that you trust to pour into you and to be there for you in this postpartum season and give you that support, please do it. So that's my summary. What I think is wrong with lactation care in America: providers don't refer enough, providers are giving bad advice. Again, I'm one of you, so I hope you can take my criticism with a humble heart, eager to learn and change and grow. Moms are not getting enough breastfeeding support in the immediate postpartum period. There's insurance coverage problems and social media, good and bad. Tell me your thoughts below. Do you agree with this? Do you not agree with this? Did I miss anything? I would love to hear your thoughts.